In today's video, we're diving deep into a topic that affects millions of people around the world: diabetes. While you've likely heard the term, you might not be clear on what it is, what causes it, or how it's managed. We're here to break it all down in a simple, easy-to-understand way. So let's get started. At its core, diabetes is a chronic health condition that affects how your body turns food into energy. Most of the food you eat is broken down into sugar, also called glucose, and released into your bloodstream. When your blood sugar goes up, it signals your pancreas to release a hormone called insulin. Insulin acts like a key, letting the blood sugar into your body's cells for use as energy. With diabetes, your body either doesn't make enough insulin or can't effectively use the insulin it does make. This leads to too much sugar remaining in your bloodstream, which can cause serious health problems over time. There are three main types of diabetes, each with its own unique characteristics. Type 1 diabetes is an autoimmune condition, meaning the body's immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. People with type 1 need to take insulin every day to survive. Type 2 diabetes is the most common form. With type 2, your body doesn't use insulin well and is unable to keep blood sugar at normal levels. This is known as insulin resistance. It often develops over many years and is usually diagnosed in adults, though it's increasingly seen in younger people. Lastly, gestational diabetes develops in some women during pregnancy and usually goes away after the baby is born. However, it does increase the mother's risk for type 2 diabetes later in life. Recognizing the symptoms of diabetes is crucial for early diagnosis and management. Some common warning signs include frequent urination, especially at night, and feeling very thirsty all the time. You might also experience unexplained weight loss, increased hunger, blurred vision, or a feeling of being very tired. Numb or tingling hands or feet can also be a symptom. If you notice any of these signs, it's important to see a healthcare professional. The causes and risk factors differ depending on the type. For type 1, the exact cause is unknown, but it's believed to involve a combination of genetic predisposition and environmental factors. For type 2, risk factors are more clearly defined and include having a family history of diabetes, being overweight or obese, and leading an inactive lifestyle. Age and ethnicity can also play a role. If left unmanaged, high blood sugar levels can damage organs and tissues throughout the body. Complications can include heart disease, stroke, kidney disease, nerve damage, and even vision problems that can lead to blindness. This is why managing the condition effectively is so critical for long-term health. The good news is that diabetes can be managed well. Treatment often involves a multifaceted approach. This includes monitoring blood sugar levels, adopting a healthy eating plan, and getting regular physical activity. For some, oral medications are necessary to help the body use insulin more effectively. For others, including everyone with type 1 diabetes, insulin therapy through injections or an insulin pump is essential. While type 1 diabetes cannot be prevented, you can take proactive steps to lower your risk of developing type 2. The most effective prevention strategies revolve around a healthy lifestyle. This means maintaining a healthy weight, eating a balanced diet rich in fruits, vegetables, and whole grains, and aiming for at least 30 minutes of moderate exercise most days of the week. We hope this video has given you a clearer understanding of diabetes. Knowledge is the first step toward prevention and effective management. Remember, if you have any concerns about your health or think you might be at risk, the most important step you can take is to talk to your doctor. Thank you for watching, and be sure to stay informed and proactive about your health.